The topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Fabulous You. I'm your host, Melanie Young. I want to remind you that I have two books I want you to check out. One is Fearless, Fabulous You, Lessons on Living Life on Your Terms, which, like my last guest wrote about in her book, deals with loss, recovery, recreating your life, and moving forward. And Getting Things Off My Chest, A Survivor's Guide to Staying Fearless and Fabulous in the Face of Breast Cancer. It's a book that you would love to give anyone who's been newly diagnosed with breast cancer to help them make informed choices about their life moving forward. We're switching gears and we're going to talk with a doctor now about it's spring here in the Northeast, and I've already picked 3 ticks off my dog and probably 1 off me. So we're going to talk about Lyme disease, which is everywhere, but really heavy where we live in the Northeast, and a co-infection called Bartonella, and a couple of other things as well that I want to slip in. My expert is Dr. Tania Dempsey, who is she is a specialist in a lot of areas of chronic disease and autoimmune disorders and mast cell activation. So it's not just Lyme disease. She's been interviewed and written about in many outlets, and she's with Armonk Integrative Medicine, which is in Westchester, New York. And we're going to dive right in. So Dr. Tania Dempsey, welcome to Fearless, Fabulous You.
Thank you so much. Thanks for having me here.
So I want to dive right in. I have a number of friends whose either daughters or they have Lyme disease, chronic Lyme disease. And I worry about it all the time. We live in the woods. My husband's in the woods. We're always doing tick checks on each other's bodies. Let's talk about the symptoms. You know, we know Lyme disease is caused by a tick bite, but the symptoms to look out for. And also, I understand that another condition called Bartonella is on the rise. So I want to explain what the differences, what they are and the differences in symptoms.
Sure. So, Lyme disease is actually caused by a bacteria called Borrelia burgdorferi, and it's transmitted by the deer tick, which is, found everywhere in the Northeast, but it's found really throughout the country. Right. And in the early stages, so if you're lucky, and I hate to say it this way, but if you're lucky and you get a tick bite and you get a rash called the erythema migrans rash, the EM rash we say, then you're lucky in the sense that you know that is Lyme disease. But only about 50% of people who've been bitten by a tick and get Lyme disease will get the rash. So there are lots of people who can get bitten by a tick, not get a rash, and still have Lyme disease. So then you have to look out for a lot of other symptoms. And the symptoms can be varied. In the beginning, we call it stage 1. There's that sort of flu-like symptoms. There's some fevers, potentially, sweats, fatigue, headaches, stiff neck. There are lots of sort of non-specific symptoms, and that starts early on. And in this time of year, anywhere from now until the fall, if you have those symptoms, you should not assume that it's just the flu or some bug that you picked up like a virus. You have to make an assumption, especially if you've had any contact with the outside, that this could be Lyme disease. And the faster you get treated, the better. The problem is that once it moves on to stage 2, we call it early disseminated, that's when it really starts to go into all the organs and all the systems. So you can get cognitive issues, memory loss, problems with your vision, problems with numbness and tingling in your arms or your legs. It can infect the heart, which can be very serious. It can affect, it can cause meningitis, which could also be very serious. So once it starts to spread, then it's a real, it's a real problem and harder to treat. And then, you mentioned you have some friends' daughters who have chronic Lyme. That's stage 3. We call that late disseminated Lyme, and that's when it's been there for a long time. It's either because it's hasn't been successfully treated, or it's been delayed. The diagnosis has been delayed, or it's been misdiagnosed, and those patients have been suffering for potentially years, and they can get serious neurologic effects from it, and so it's neurologic. It can affect the joints. They can get severe arthritis, cognitive issues. I have patients, who really were great students and can't finish college. They can't work, so it can be really debilitating.
Well, the thing is, and so there's 3 stages, right? Of Lyme. So here's the thing. It's a lot of those symptoms are other, like, there are many symptoms like that. I mean, there are people, so how do you, when you go to the doctor, well, first of all, how do you know you have a tick bite? Because I got to tell you, that little Lyme tick, it's a tiny little sucker. And my husband's like, can you check? I mean, he'll ask me to check places. I'm like, really? You want me to check there? Like, you got to check everywhere. They're little crazy little suckers. And then they may be in your bed if your dog is in the bed. So let's talk about how you discover the tick.
Yeah, that's the challenge. There's no question. Some of these ticks are the size of a poppy seed. And if you have hair on your body, you think about if that poppy seed tick gets into your scalp, right, under your hair, how are you going to find that, right? And they get into all the nooks and crannies for sure. So it is difficult. You have to be really methodical about it, and you have to be checking all the time. And even still, and I don't want to, sound very pessimistic here, but even still, you could miss it. And that's the problem. So you have to prevent. You have to prevent the tick bite in the first place.
Well, how do you do that?
To be very, very cautious. Well, right. So so you have to protect yourself with repellents, insect repellents. So basically, every time you go outside, and it does sound like a lot of work, you have to sort of make an assumption that you are going to be exposed to ticks. So you put on whatever insect repellent you feel comfortable using, and there are a variety of them, from things like DEET, which maybe a little bit more on the toxic side. Next would be something like picaridin, which is still a repellent, and is still a chemical, but it's probably safer for kids. And then you have sort of the oil of the eucalyptus and some of the more natural essential oils that you can use, but you've got to use something when you go outside to repel the insects off the body. And then you also should protect your clothing. So I recommend that you either buy clothing that's already sprayed and treated with insecticides, or you do it yourself. And you buy something called permethrin. You bring your clothes outside on the lawn, you spray the permethrin on the clothing, you let it sit, and that insecticide can stay on for up to 6 washings. So that basically kills the tick the minute it hits the clothing. I mean, it's pretty fast. There's pretty good data on that. So you want to do all that to prevent even, the chance of getting a tick. And then, yes, you still have to check yourself. You strip all your clothes the minute you walk in the door. You got to get all the clothes off. Do not walk in the house with the clothes that you were outside with, because those ticks can just fall off, and then someone else picks it up, or the dog picks it up, right? So, it is concerning. You do have to be careful, because we are in the middle of an epidemic.
So there's no, my dog has a Lyme disease vaccine, right? Because he's had Lyme disease twice, and he has a vaccine. And I learned to watch putting him in bed. That's enough. Your dog gets in bed with you. Right. Next thing you get ticks in your bed. Right. There's no vaccination for adults or kids for Lyme disease, is there?
No. There was a vaccine a number of years ago. It was removed from the market for a variety of reasons. I know there is work on some newer types of vaccines. I think it's still in the research phases. And, we'll see down the road whether we could find something to prevent. But it's necessary, but we're not there yet.
And I don't think, I hear like I said, we live in the Hudson Valley, and I hear ads for, let's come spray your lawn. You know what? You're not going to, I think, I personally would have my lawn sprayed I don't want chemicals all over my lawn, but I can't imagine that it really would last with all the deer we have running around. They're everywhere. It's like, I just can't imagine spending that much money. I think, now I have had a couple doctors on the show, and I do want to say that DEET, while some people are afraid of it, I've also had some doctors on the show who said it is not going to give you cancer or all the things people say it's going to do to you. And in the long run, spraying yourself with DEET is far better in protecting yourself against malaria, mosquito-borne malaria, or ticks than your much, much lower risk of getting cancer. So I do want to note that, because I have addressed that many times, and it made me become a little more open to using DEET on my own body, because and wear socks, make sure you're wearing socks and all the, shoes, don't go out barefoot, which everybody wants to do in their flip-flops. I want to talk about this other condition, Bartonella, which I know less about, but I understand it's becoming on the rise as well. So what is it?
So Bartonella is another bacterial infection. And the problem is, the reason it's on the rise is because it's actually transmitted by lots of different types of, we call it vectors or insects, not just ticks. We know that ticks can transmit it. We know that ticks can transmit multiple types of infections, bacteria and viruses and other things. So, but the thing with Bartonella is that you can get it from biting flies, lice, fleas, spiders, and there are cats and dogs who are actually considered healthy. They look healthy, and they can be carriers of Bartonella. Bartonella used to be called cat scratch fever. So it was a bacteria that you could get if a cat scratched you. So we know cats carry it. And we now know that their fleas carry it, and all these other insects. So the thing about Lyme, right, is that we know that there may be pockets in this country, in this world, that may have more Lyme. The thing about Bartonella is that it's found every single place in the entire world, because every place in the entire world has different types of insects. And so that's the problem. That's really the next epidemic. Even more concerning.
I think Bartonella, there's a vaccine for dogs against Bartonella.
I don't think so.
No, Bordetella. Sorry, so. Wrong. Bordetella. I correct myself. Bordetella. Yeah. Totally different. That's Kennel Cough. So, how do you know if you have Bartonella? And what are the symptoms?
Right. So, the problem is that there can be an overlap with Lyme and some of these other tick-borne diseases. Many of them will cause fatigue. Many of them will cause neurologic symptoms. And muscle aches and headaches. There are some key features about Bartonella that, if you have it, will make it a little more obvious. It can cause what we call track marks, or they look like stretch marks. They tend to be red, though, where stretch marks can be kind of silvery. These tend to be red. They tend to be in sort of the areas like in the flanks. It could be sort of near the underarm area, across the chest, across the back. And that's a hallmark feature for Bartonella. And so if someone has that, they should immediately get tested. But not everyone gets that. And if you don't have it, doesn't mean you don't have Bartonella. Bartonella can cause, in later stages, can cause a lot of I will call it neuropsychiatric disorders. And we have plenty of research and studies that are supporting the fact that Bartonella can cause things like psychosis, encephalitis, anxiety. And so when even obsessive compulsive disorder. So when we see people who have acute onsets of those things, and they have risk factors for having gotten Bartonella, we definitely will they need to be tested. Bartonella, the difference between Bartonella and Lyme also is that it can survive in the body undetected for many years. It's we call it a stealth bacteria. So that means is that whereas Lyme, you might start getting symptoms early on, shortly after a tick bite, even if you don't know if you've gotten the tick bite. Well, Bartonella can actually infect the body, live for a long time. It lives in red blood cells. It lives in what we call the endothelial cells that line all the organs and blood vessels. And it can sort of stay in that area almost dormant until something sets it off. And that's the challenge. And so often people have been infected many years ago before they get sick.
So let's talk about, obviously, if you have any of these symptoms, go and see your primary care physician and say, I'd like to be tested, because, you got to ask sometimes to get the test. But how are they treated? We have about, just so you know, we have about a minute left. I want to talk about how these are treated or managed.
Okay. Well, the standard of care is antibiotics.
Right.
Bartonella, usually we use antibiotics like azithromycin and rifampin. Lyme, we'll use doxycycline and ceftriaxone. So there are lots of different antibiotics. I come from a more integrative background, so I use antibiotics, but I also combine it with some herbs and support for the gut and lots of probiotics. And so I'm using a holistic approach because often these patients don't get better just with a round of antibiotics, especially if it's a later stage.
Well, and also antibiotics can wreak havoc on your gut, and we all know, there's a direct correlation. So I support an integrative approach in anything you're doing, particularly when you're on antibiotics and being treated for what essentially becomes an autoimmune illness when you're dealing with these kinds of things. I think it's really fascinating. I want to make sure I give everybody your website, because you've got a terrific blog, and you've got one here. We can't get into it. Is Sushi Safe to Eat? The health risks, and it's all over the news right now because of E. coli, but there's also mercury risk. So for all you sushi eaters, go to, besides learning about Bartonella and Lyme, go on now and read Is Sushi Safe to Eat? The health risks of eating sushi. It's www.Dr. Tania, Tania Dempsey, DEMPSEY.com. Really a joy to have you on. We'll have to have you back to talk about some other topics. I appreciate your integrative approach, and I appreciate your explaining these two really serious conditions. Everybody out there, be vigilant. Enjoy the outdoors. Get your vitamin